Hi, I'm Tom, and I'm talking to you from my studio here in Los Angeles. At the beginning of 2015, I was suddenly hospitalized with internal bleeding, and at first, the doctors weren't sure I was going to live. And thankfully, through some quick and smart thinking, the team of doctors were able to stop the bleeding. And they then found that the cause of the bleeding was a large tumor on my pancreas, and it was diagnosed as NET. And so January 5th, I woke up in the hospital. I had been on a ventilator for 3 days, so I didn't even know where I was. It was a really strange experience because I'd never been in the hospital before. And it was actually the hospital where my wife worked. She's a nurse practitioner. And the very first thing I had to do was I had to have major surgery to remove the tumors, which had metastasized to my liver. So a month later, I went into the hospital, had surgery for the first time in my life. It was a really major surgery. I like to say that I like to start things with a really big surgery. So it was a very long and difficult recovery period after the surgery. Unfortunately, only a couple months after my surgery, an MRI scan showed that the cancer had continued to grow. And so I started a somatostatin injection monthly. And about a half year later, we saw that the cancer was still growing. So we knew that the somatostatin injections were not sufficient to control it. So we had to consider various options. And one of the options was some sort of chemo agent and an oral chemo agent. But at this point in time, I was still recovering from the surgery. I was on a lot of pain. I was on a lot of pain medications, and I just didn't want to take any more medications. My oncologist was aware of PRRT as an option. The the NETTER-1 trial had finished and showed very good results. My wife, Lisa, was doing a lot of research online, talking to other patients, talking to doctors, and gathering information about PRRT. At this point, it was not yet approved in the United States, so my options were either to travel to Europe or to go to Texas, where the treatment was being offered under the Texas Right to Try law. It was pretty simple decision between those two because I was not doing well and I don't think I could have traveled to Europe. So we made the decision to go to Texas, and we flew to Houston, and I had 4 rounds of PRRT over the course of, I guess it was about 6 months. At the end of 2016, when I returned for my scans, the doctors were absolutely amazed. There was no evidence of cancer. The MRI scans were completely clean. My gallium-68 scan showed nothing. And so it was a full response to the treatment. So at that point, I was able to, for the first time since the beginning of 2015, get back to trying to live a normal life. And by 2018, I was pretty much back to normal. And my wife and I celebrated by traveling for the first time that we were able to travel. Actually, last year, I did have to have a retreatment of PRRT, but at this point, it had been approved in the United States. So I was able to go for treatment at a UCLA Medical Center, which is only 2 miles from where we live. It was completely different than having to fly to Texas. In fact, it was absurdly simple. We just drove there. I had my treatment and we drove home. And the total time was probably about 6 hours. The treatment itself is kind of unexciting, really. For a few days afterward, I would feel tired and kind of like I have a mild flu. But other than that, I had no serious side effects. So at this point right now, in 2020, my disease is stable. There's still a few small spots on my bones that we're monitoring with periodic scans. They haven't changed for a while, so we think that for now, we don't need to really worry about it. At some point in the future, if I need to, I could have PRRT again, probably. Of course, I'm a big fan of theranostics. It's a really, it's saved my life. So of course I'm a fan. And I would love for other people to know about PRRT as a treatment option, and I would like people not to be afraid of it. I would love if people had more access to it. And I think that, organizations like Considium that are providing information are playing a really valuable role. And I really feel that, over the next few years and looking out over the next decade, there are going to be a lot of really exciting developments in this area. So I think that gives us a lot of hope.